I think what we're also doing is creating a model, a new model for a behavioral and mental health workforce that I think we can now demonstrate not only to the rest of Minnesota, not only to the Midwest, but really to the entire country.
Welcome everybody to The Force for Good. Really, it's a very exciting episode for me. Now that I've been with the Miller-Dwan Foundation for just about 16 months, when I started with the foundation as the senior mental health advisor, one of the things that the president of the foundation really wanted to identify, and part of our mission as a community foundation, was really how do we become more present and helpful with the mental health crisis. And in that work, Tracy suggested maybe I take a look at what's happening in the global world, what's happening on a national level. And so I started with the World Health Organization, because if you want to get really good information, you start with the World Health Organization. And that led to me discovering this program called Problem Management Plus, which was really intriguing to me. And I did a lot of research on Problem Management Plus and really started to appreciate the model itself, which led to reading a lot of work that was done by Dr. Brandon Kohrt from George Washington University. From there, I thought, okay, I need to figure out a way to try to connect with Dr. Kohrt, or I need to keep looking and see how else I can get connected into this network. So I truly emailed people from all over the globe, which led to a professor from University of Amsterdam who pointed me in the direction of asking her about PM Plus. And she said, I think there might be some work going on in New York City that might interest you. You might want to reach out to Dr. Adam Brown. So fast forward now 1 year, about a year, I guess. It's gone really quickly. Those two are my guests today. We are now in a collaborative contractual relationship with both the New School for Social Research and George Washington University. So joining us is Dr. Brandon Kohrt, MD, PhD, who is with Charles and Sonia Ickman Professor in Global Psychiatry, Professor of Psychiatry and Behavioral Health for Global Health and Anthropology, the Director for the Center for Global Mental Health Equity, the Vice Chair for Research, Department of Psychiatry and Behavioral Health at George Washington University. Good to see you. And also Dr. Adam Brown, PhD. He is the Vice Provost for Research and Associate Professor of Psychology and the Director for the Trauma and Global Mental Health Lab at the New School for Social Research. Welcome, both of you. I'm so thrilled. And if anybody ever would have told me that I would be talking to the two of you in a podcast, I would have told them they were off their rocker. It just not even a possibility. So I remember the first time I met both of you, I was almost so starstruck I couldn't talk. It's gotten a lot better. So Brandon, if you'd like to give some context to the kind of work that you've been able to do with scalable mental health, with the World Health Organization, with PM Plus, that would be wonderful.
Yeah, I'd be delighted to. Thanks for that very kind introduction, Rick. So my background is as a psychiatrist, and I'm also trained as a medical anthropologist, and I've spent about 25 years mostly focused on what do we do after disasters in low resource settings. So initially had worked in Nepal in the late 90s and early 2000s after a civil war had taken place there. And then from there went to work in Liberia with the Carter Center, focused also on post-conflict mental health needs, and then expanded to Haiti after the earthquake, parts of northern Uganda, back to Nepal after the earthquake there. So really kind of following these situations of really high need for mental health services. And it's also been fortunate that over the 25 years of doing this, there has been more and more recognition on a global scale that when these disasters happen, simply doing physical health, basic kind of survival needs is incomplete without mental health. That for any
Sure.
disaster recovery, emergency recovery, mental health is part of the whole health process. And one of the major, advances that World Health Organization has led in the past decade or so has been these scalable interventions that can be delivered by people who have no mental health background. They're not clinical social workers, they're not clinical psychologists, they're not psychiatrists. In many cases, they might not even have a college degree, but they can be trained up in a brief intervention that might last 5 or 8 sessions. And Problem Management Plus is one of the first ones that was built from the ground up as an intervention focused on these non-specialists. In many cases, prior to that, people had been adapting cognitive behavioral therapy, interpersonal therapy, but taking it from kind of an expert level and then reframing it for non-specialists, these individuals who don't have a clinical background. But really, all the thinking into PM Plus was start from the ground up in this way. The other stream of my work has been thinking about when we're working with non-specialists, how do you be sure that they can do it safely and effectively to make sure that
Exactly.
they're competent to do this,
Yeah.
deliver these services. And so with the World Health Organization and also with UNICEF, since 2018, we've developed something called the EQUIP platform, or Ensuring Quality in Psychological Services. So really, it's these intersection of the PM Plus work and the EQUIP work that led to the collaborations with Adam and then to the collaborations with the Miller-Dwan Foundation.
And Brandon, when you talk about scalable, what does scalable really mean?
So I like to refer to this as the 10,000 hour problem. So we at least I'm pretty comfortable say we Americans, and especially we Americans in fields of academics, and especially those in mental health, have this idea of somebody really, really needs to be an absolute expert. And you've got to do the Malcolm Gladwell 10,000 hours before you can be really a skilled therapist, a skilled mental health provider.
Right.
Well, if you divide, 10,000 hours by, about 80-hour courses, which is how long these things typically last. It's about two weeks of training. You can train closer to like 200 people instead of just one.
Right.
So scalable, the idea is rethinking training models from everybody has to be, a virtuoso to everybody needs to be a good enough therapist to be able to really get this scaled, throughout places like Minnesota, New York, and globally.
Nice. Thank you for that. And so, Adam, your connection with Brandon, can you talk about how that connection was made and how you continue to work together? First of all, how did PM Plus come to New York City?
First of all, it's great to be here, and Rick, thank you so much for bringing us together and for continuing this conversation. PM Plus came to New York City really out of need. So my background is very much in trauma and trauma research. Like Brandon, I've spent the last almost 2 decades working with communities and individuals impacted by adversity and by trauma, but from a very different perspective. I wasn't necessarily working in low-income context or low-resource context. I was working primarily in the US with folks like combat veterans, people impacted by terrorism and other kinds of challenges, and had done quite a bit of research on the biological and psychological changes that occur in the aftermath of trauma. I think, like a lot of folks, though, it's become increasingly apparent that while this research to understand and characterize the nature of things like post-traumatic stress disorder is so important for the development of prevention and therapeutic strategies, the need for care is just so enormous, both locally and globally. So I began, similar to you, Rick, to kind of look outside of the US for other models. And I too stumbled upon task sharing, capacity building strategies that the World Health Organization was doing. Somewhat serendipitously, I had a meeting at the WHO in Geneva and learned about things like PM Plus and became very curious about it and asked some questions about the possibility of bringing it to places like New York, where I knew there were communities who could benefit so much from it. It really wasn't until 4 years ago, when the pandemic hit New York City in such a direct way, that I reached out to the Red Cross and I reached out to the World Health Organization and said, this is a moment where we need to respond to our communities locally with something that will enable us
Right.
to support them quickly and where we can reach a lot of people. And it was through that original adaptation, which was two things. One, how do we bring PM Plus to the US for the first time? How do we bring PM Plus to the US remotely, because it wasn't safe for us to be
Oh,
together yet? So there was that
sure.
level. And through
Yep.
all of those discussions, I was connected with Brandon as a part of that work early on. And so very much in the
Okay.
beginning of us starting to do the training, starting to do the rollout, I got connected to Brandon around the work he was doing with Equip as an essential piece of ensuring that the people we were training were ready to do this work in New York.
And so the project in New York City is called Recoup New York. Where's that work? What's happening with that work today?
Well, maybe I'll set it up like what led to Recoup, and then Brandon, maybe I can pass it to you. So when I first met Brandon, this was before we had a large randomized control trial. We had never done this in the US before. We wanted to take a very careful
Nice.
approach to doing this work. We started by training masters and very beginning level clinical PhD students who could deliver PM Plus to the community. That started going well. We reached out to some community partners, some community organizations through the mayor's office of New York. We trained a small group there. We trained them well. They started delivering it. That was going well. The data was looking good. People were telling us that they were benefiting so much from it. The people we trained felt like there were many benefits they were receiving as people we trained. And it was really through that initial pilot work that we then began to imagine maybe we can do something much larger to really study
Nice.
the efficacy of this. So, Brandon, I'll turn it to you to talk about Recoup.
Sure. Thanks, Adam. So I think that we've all hit on a common timely theme here, which is there just is not enough accessible mental health services in the U.S.
Absolutely.
And those services are very inequitably available. So individuals who have private health insurance, typically individuals who may be middle upper class, often white, ethnic, and racial backgrounds. But that those individuals who don't meet those criteria don't often have access to the services that they want. And fortunately, during COVID and in subsequent, in the current White House, there's been an interest in expanding the behavioral mental health workforce and really doing the things that Miller-Dwan's pioneering. And so what Adam and I were able to kind of find this timely opportunity is that the National Institute of Mental Health that funds research, including clinical trials, was interested in supporting evaluating interventions that could be rapidly deployed. PM Plus is something that you could train somebody in 2 weeks and start services right away, and something that could be delivered by individuals who weren't specialists. And so Adam and I initially got what was called a kind of a pilot or a supplement grant, which was just a year of funding to say, all right, in a year, prove to us this is worth funding. Mm-hmm. And then after that, because of the success that Adam mentioned and the really strong partnerships of the new school with the mayor's office in New York, we were able to get a 5-year funding to do a clinical trial. Now, we often think of clinical trials as things for new drugs, cancer treatments, or new psychiatric medication, but every time a new psychological treatment or psychotherapy becomes available, that also has to be evaluated to show that it has an evidence base. Exactly. And although, as Adam mentioned and you pointed out, Rick, there were a number of trials globally, no one had tested this in the US. So we're able to make the case that we need to do this. And this is a very large trial. So we're working with almost 40 different community-based organization sites in New York City, and ultimately will enroll about 1,000 beneficiaries, the people that will receive PM Plus, and will train about 45 different helpers in these community-based organizations throughout New York City, and compare this to existing community-based organizations where they're delivering their typical normal services, which in many cases are putting people on wait lists. Sure. It's referring people to a specialist and then waiting, ideally just a few weeks, but often it could be 6 months. In some cases, it could be more than a year to be able to get them into care. A recent survey done by the New York City Mayor's Office showed that there's over a 500,000 people who were not able to access mental health services in the past year, but who self-identified as having a mental health need. So kind of all these things came together, the partnership with Adam, the support from the Mayor's Office in New York City, and the National Institute of Mental Health that wanted to fund this type of clinical trial.
So to your knowledge, both of you, are there other organizations, other places in the United States that are really doing this kind of work with research data, equip, PM Plus? And is anybody else doing this work that you're aware of?
I can start, and I'll turn it over to Adam. So prior to doing this, there was a program in Iowa where they were working to train refugees to be able to support other refugee populations, particularly Congolese, Sudanese, and some other groups as well. This was a very, very small project, kind of proof of concept. And there are some other examples. Some colleagues in Florida have used this with migrant populations, Spanish-speaking migrant populations. Adam might be able to tell you a little bit more about some programs also going on through some large insurance companies. But none of those programs and approaches have done a rigorous evaluation in the sense of comparing it against what is typically happening in those settings. So before you release a new drug on the market, first question is, does it do harm?
Right.
And you want to be sure that it doesn't. Right. And so why this more expansive, rigorous evaluation is so important is to establish that therapy delivered by a person who's not a clinician doesn't do harm to those clients of the community-based organizations and the general public. And at the same time, that it's not harmful to the people that we expect to deliver it. We want to make sure that if somebody's not a specialist, that, delivering mental health care is a super, super stressful job, as the three of us know. So asking somebody who doesn't have that background, making sure that this is not burdensome or stressful for them. But let me turn it over to Adam, and he can mention other types of programs and initiatives.
Yeah, I mean, I think it fits within a broader range of strategies to support non-mental health specialists that are not necessarily new. I mean, we've had peer-to-peer, we have had mentorship programs, we've had even things like interpersonal therapy, as Brandon mentioned before, that had been adapted to be delivered by non-mental health specialists. I think one of the things that is especially different, Brandon, correct me if I'm wrong, is what you might call bidirectional or reverse learning, what we're doing here. Most of the time, the West, the US in particular, creates an idea and then exports it out to the rest of the world. One of the things that we're doing is we're taking knowledge bases that have really been developed outside of the US, taking all of those learnings, looking to communities, in low-resourced settings, low-resource contexts in which there have been humanitarian emergencies, and saying, tell us what you've learned from all of that work, and then let's try to adapt it to places like New York and Minnesota and other contexts. So I think in that way, it is unique. In addition to that, there are some other programs. Blue Cross Blue Shield, the major insurance company in the US, very excited about that. They've started a pilot program in Massachusetts. Again, I think a lot of the initiatives Brandon mentioned, it's given the need and given the urgency, there's a greater focus on just rolling it out and evaluating, can we just get this out there, which is important given how many people are struggling with mental health issues. I think Brandon and I just feel really grateful to have the funding and the time in concert with everything else happening to also do a definitive study on whether this is effective, whether it's safe, and whether it truly can be a viable capacity building strategy. So it's great to see the interest building. And I think as we look to change policy and to change a lot of minds about how we think about care, I think the data that's going to come out of this NIMH funded study is going to go a long way for building that argument.
And so now fast forward, and we're going to take all of that global sort of information and the wonderful things that have happened all over the world, then to New York City. Adam, you so kindly returned an email, right? It's like, okay, can you just help me? Just help me. And we're able to meet. Why the Miller-Dwan Foundation? What was appealing to you after that initial conversation? Because we went quickly from a meeting with you. I believe it was the next week. It was meeting Brandon, and the next step was welcome to Global Mental Health, Miller-Dwan Foundation.
I think what drew me so much to working with you, aside from your winning personality, Rick, was
flattery will get you everywhere.
was the deep connection to the Duluth community. If there's one thing that Brandon and I have learned together in all the work that we've been doing in New York is that relationships are everything. Um, Scalable mental health interventions, capacity building strategies are really built not on one person who's very wise teaching people a lot of things. It's really about people coming together to support one another and to reach people who are in need and are at their most vulnerable. The Miller-Dwan Foundation has a long history in Duluth of finding ways to support people, and had spent a lot of time through your own strategic planning, identifying what are the greatest needs of the community. How do we get that buy-in? How do we listen to our communities to meet them where they're at? And for me, those are exactly the ingredients you need for a successful rollout of Problem Management Plus. And I think that's in part why it's been so successful so far. And I really just valued so much in our original conversation how you talked about the community, how you thought about which stakeholders to bring in, which voices you wanted to lift up to be a part of this work. I just felt immediately they get it, even if they haven't yet been trained in this work, even if they haven't gone through all these materials, the underlying sort of ingredients that are needed to do this work well, I thought was there from our very first conversation.
And I think we felt basically the very same thing. And now both of you have, we've entered into a contractual agreement with GW and the New School. Adam, you have been to Duluth a couple of times. Brandon has been here virtually. He was actually part of our initial work on a great big screen in front of everybody. And we have now, we just completed week 9 of a 12-week training for our initial pilot project. From all of your experience with PM Plus, what would both of you see as possibilities for what's happening with the work specifically in the Twin Ports?
So in all of the good ways, working in the Duluth area is very similar to working in a lot of low and middle income countries. If we think about New York City, a population of 8 million, that's like 2 Liberias, and
right.
we struggle to get one program into Liberia. But often when you're working in the low and middle income countries, you rely by necessity on the community, but that community is your biggest possible asset. And building on what Adam was just saying, that connection of Miller-Dwan to the community, you're already in the YMCAs, you're connected to LGBTQ community-based organizations, those serving Black and Brown Minnesotans, those with the, from the indigenous populations. So those community relationships are really the fuel that makes everything else possible. And so what we're really excited to see is kind of how this can take off and begin to kind of self-replicate and expand. Once you really empower our organization, can you give them all of the ingredients, the training, but also those ideas around implementation, how to do this, so that they can then carry that forward? And I really see Miller-Dwan as kind of the match that lights all of these fires. Nice. To really ultimately, heat the cure for mental health problems throughout the world. So where I see the kind of strength is around those community connections and building those to see how this grows. because just the traditional psychiatric model is so removed from the community. It's really this one-on-one, isolated, behind closed doors kind of approach.
Right.
But if we want to heal from COVID, if we want to heal from economic challenges, racial challenges, that can't be done behind closed doors. It has to be a community-based process.
Nice. Adam, anything you want to add to that?
I think in addition to everything Brendan said, I think what we're also doing is creating a model, a new model for a behavioral and mental health workforce that I think we can now demonstrate not only to the rest of Minnesota, not only to the Midwest, but really to the entire country, that there is a new way that we can engage people in doing this work, train them well, and then support them to reach communities in need. Right now we have, I think, a really great model that's working pretty well. And as we begin to generate more data and more information, I think that's when we can also work closely with policymakers on a federal level, on the national level, to say, let's open up, let's create new policies to support people in a sustainable way so we can build out this workforce. And I think what we're doing in Duluth right now is very much at the core of that enterprise.
And it's, again, serendipitous, and in sort of a summary sort of way, as we started our latest initiative of HopeX. HopeX is, the whole theme of HopeX is, how do we multiply community healing? And Tracy has said from the day that I started, how do we create a new workforce that can really do the work and really have an impact? And we could start something in the Twin Ports that could go to the Twin Cities, that could go nationally. And to your point, Adam, it's almost that whole global perspective now coming into the United States and landing in New York and landing in the Twin Ports. And now we have this wonderful opportunity to continue to work together and to move this work throughout the United States. And that is multiply community healing. I can't thank you both enough. We, of course, will have many, many more conversations. I so appreciate the global perspective. I appreciate all the work that you've done, the collaboration. We've got a lot of really wonderful things in front of us. Our relationship is, I think it just epitomizes everything that PM Plus is really all about. We rely on one another. We work as a team. We're going to continue to move forward. And now to you, welcome to the Miller-Dwan Foundation.
Thank you, Rick.
Thank you for joining us today. It was a wonderful conversation for me, and I'm sure it was full of a lot of great information for everybody else. You'll be able to find the podcast. You can watch, you can listen. It'll be on all social media. And we, of course, invite everybody to continue to join us in the force for good.